So Dr. Lena, I'm sorry to cut you short.
It's okay.
A woman out there wants to understand preeclampsia. Then another thing, you said something, she's having abdominal pain. I'm telling you, I'm from a community whereby we have clinics in our area.
Yes.
Kila kewa msao akwe painkillers. Chija kukakana. We have our mothers. I'm sorry I've gone fast forward, but I want you to touch the myths that we believe. You see, someone can get a pain and they're like, I can get a painkiller, it's okay. But now this is a headache, the abdominal pain. Then there is preeclampsia. Then I see some spotting. I'm like, it happens. Because my mother has told me, it happens, chibao. But now, let's say I'm a first-time mother. I am literally clueless. Also talk more about women ignoring antenatal because there is a belief that you don't need to go. Please continue.
Those are so many questions.
I'm sorry,
I hope I can be able to remember them
from what you say.
Let's start from
in the first. You called it the first.
The first delay. Delay number one.
Yes.
So you picked preeclampsia and delay number one. That is a medical jargon.
Yes.
But it's mainly high blood pressure during pregnancy, and it has different definitions depending on the stage.
Okay.
So maternal health is interesting because now that is a wide topic. You can have high blood pressure before you even get pregnant. And when you don't even know it. Now, high blood pressure itself in pregnancy is extremely dangerous. Okay? It can kill. It is the second killer, by the way. And Kawempe, they did a study recently, and it is one of the, at one point, I think at one point last year, it even went above bleeding in pregnancy. So high blood pressure, my friends, is something that we have to talk about seriously.
Yes.
So that is driving us into what I had called preeclampsia.
Okay.
So high blood pressure during pregnancy, you can have it before conceiving, okay? But then when you come for antenatal, we diagnose at 20 weeks. That is when we say, now this is what I had called preeclampsia. How does it manifest? What are the signs that a woman should know and a spouse, that the community should understand? Number one, severe headache. When you get severe headache, please, yes, it is okay to take paracetamol, but what if that headache doesn't go? Okay, that raises a flag. And then, now, some people take Panadol, some people will take even Brufen, which is dangerous. Brufen can be dangerous depending on the trimester, okay? So self-medication alone is also not bad. So you're going to get severe headache, omutwe gukuluma, eddagala terikola, you'll put something here, you'll go and test for malaria, and they'll say you don't have malaria, okay? Then you can get chetuite chifu, kumaso, you can get some visual blurry, blurry vision. And it doesn't have to come at once. That, oh my God, blurry vision, no. You can remember, like yesterday, by the time I woke up in the morning, and then you have a headache. And then today, then in the evening. So it's not something that is going to come at once. Then you can have abdominal pain. Ulcers, and yet, the disease condition is affecting the liver. Preeclampsia is affecting the whole body, starting from the head, the kidney. It will affect the kidney. And then they later go into dialysis. Okay, and then they have to help the kidneys. So that spectrum of things is all in preeclampsia. Nozimba amagulu, nozimba engalo. You have edema, you have swollen feet, swollen hands, the face, you wake up and it is puffy, it is swollen. Those are all signs. Those are all things that you have to look out for. Please don't stay at home. Like I said in the beginning, maternal emergencies may not be all of a sudden. Some come gradually, and yet it is going to kill you. Because even in hospitals, and the women here will tell me, women die when they are talking. Okay? Ayogera. Msawo mwana wange. Kumbe, she's bleeding. Obulamu bugenda. Msawo mpulira. Obulamu bugenda. Nga yakazala. Okay? So, they die while talking. Abo betulabyeko, which is all of a sudden, yes, Jebali. But when we talk about maternal emergency, we have to open our eyes, open our ears, be very conscious, anticipate, recognize, and give a right diagnosis so that you can be able to give the right treatment for this woman.
Okay.
Then there was another question on...
I was talking about the women who dodge the steps of antenatal. But the term is not showing. Why am I going? I'm okay, I'm still eating, and I'm fine. And yet you've said high blood pressure can surface anytime.
Yes.
Anytime. It's not about any stage of the pregnancy. It can surface. So tell us about those people.
I think, thank you very much for bringing that out. It is very common. And this is what I have to say to our viewers. Every pregnancy is different. This issue of saying, they are the ones actually who don't come. Oh. This is the second pregnancy, third, fourth, you know. They're like the legend.
Oh. Eh? Legend.
The legend. Yes. Every pregnancy is different. So the moment you realize that lugudemu, it is important for you to go. Kuba tomaina je lugude. Could be an ectopic. Lugude mu tubes.
Oh my God.
And then you have your abdominal pain. It is almost rupturing until you get a life-threatening situation. I have collapsed. Or, I'm bleeding. Then you remember. So as soon as I encourage all the women, come to the hospital. Yes. There are so many things that are diagnosed first time in pregnancy. I have a situation of a 34-year-old, actually 34-year-old young woman, 35 actually. Yeah, it's the first pregnancy.
Yes.
Olubuto lwalirwa 9 weeks. 9 weeks really. She has missed like one period. She's going to miss the second. So abata never bitegeera oba ali lubuto. 34 years old, 9 weeks pregnant. Of course yalina weight, she's overweight. Ajja mu ddwaliro gatassa gamba doctor sisa, I have difficulty in breathing, mpulira oxygen tayingira. What comes to your mind gwengo omusawo? First of all, tamanyi nti alina lubuto. Okay, God. Now I'll tell you what we were dealing with. She has just come as because abaddemu n'ekifuba ne ssenyiga, and she's like badde n'ekifuba nina ssenyiga, and then you will just start your antibiotics. But it is very important to take a good history, because we later found out she's pregnant. And it is because of that small baby we are saying, 9 weeks, yalese the condition, yes, which we call pulmonary embolism. It's a condition whereby the lungs are decompensated. It's a condition, I'm trying to explain it, but it's a condition related to pregnancy that was going to kill her. Not pneumonia, and she was breathing. Naye ate n'ekirala ne tumudiagnosinga ne diabetes for the first time. Olubuto lwa myezi emeka? 2. First time. So those two conditions were going to kill her. Ngolubuto just rakagwamu. So ebiseera bingi nnyo abakyala, there are conditions that we diagnose first time in pregnancy. Gobeera nga tomanyi na kumanya nti I have a problem with my kidneys. Olubuto ne lugwamu n'otandika nfukafuka buli kaseera. Musawo muno mbeera mu nnumba. Come immediately. Luyinza okuba olubuto lwa 4 oba lwa 5.
Legend.
Yes.
Thank you so much, Dr. Elena.
Welcome.
Yes.